Also, the deadline for healthcare workers all over Colorado to get their first COVID vaccine in order to comply with a state mandate.
But there is some confusion tonight as to when the State Board of Health would penalize them. Hospitals and nursing homes tell CBS 4 that they have been told that any punishment will not come until November 1st. Sean Boyd joins us live in Broomfield tonight with the details that you'll see only here on CBS 4. And Sean, this could have a big impact if tomorrow's deadline holds.
Yeah, Karen, according to the Board of Health, more than 7,500 healthcare workers still have not received their first shot. That's about 20% of those who work in healthcare statewide. In the metro area, nursing homes and hospitals like this are really close to meeting that mandate, but in some rural parts of the state, it's a different story. Last month, as Montrose Memorial Hospital saw a record number of patients in its ER wrestled with a staffing shortage that caused it to close beds and continued to fight a pandemic, it received notice from the Board of Health it had 30 days to make sure every employee got their first COVID vaccine.
Letting our employed caregivers go because of a mandate is really hard for me to swallow. When they're good caregivers, and this is the only thing that is driving them away.
While hospital CEO Jeff Mengenhausen wouldn't say how many employees are still unvaccinated, he says for every nurse that leaves, the hospital loses 4 beds. And he says some employees will leave before getting the vaccine for a variety of reasons, including, he says, misinformation.
Because everybody says it's science, but unfortunately now we're dealing with emotion.
At Larchwood Inn's nursing home in Grand Junction, Executive Director Melissa Latham says she too is fighting to keep the staff she has.
We have 23 that's on an edge that I got to call personally again to get their vaccination plan. We have 7 that is definitely leaving.
She says she's been forced to hire 2 people just to keep up with all the testing, tracking, and reporting the state has required.
The vaccination clinic itself is hours and hours and hours of staff time.
Moving in a matter of weeks just doesn't make sense.
Josh Ewing with the Colorado Hospital Association among those who's appealed to the Board of Health, which he says has agreed not to cite facilities until the October 31st deadline for the second shot. He says it's also considering 90% compliance instead of 100%.
The vast majority of hospitals in Colorado are at or nearing that 90% threshold. And so we believe that that is an appropriate threshold.
Hospitals below 90% due to religious or medical waivers would need to test employees every 2 weeks, which Mengenhausen says would cost his hospital more than $500,000 a year.
And that's just putting an extra burden onto us.
There's going to be closures.
The Board of Health plans to hold a hearing October 21st to consider allowing facilities to meet 90% compliance instead of 100%, which is the requirement, by the way, for the flu vaccine. The board also wants to see what the federal government's vaccine mandate looks like for healthcare workers. That's expected in the next couple weeks, and any facility that doesn't comply with that stands losing Medicare and Medicaid reimbursement. Live in Broomfield, Sean Boyd covering Colorado First.